Hello, this is the storage. First of all, we're going to put the instruments in the sterilizer. As you can see, the tape is blue with a white stripe, as the locks are blue. Once these go in, it gets sterilized in the sterilizer. Once it gets in the sterilizer, it's going to sterilize. It takes about an hour to 2 hours to sterilize. It's going to walk you around here. Okay, so once it's sterilized, it's going to come out of the sterilizer. And as you can see, when it comes out of the sterilizer, the tape color has changed. So the tape is blue and black instead of blue and white. And the dots are black instead of blue. The reason why is because these indicators let people know that these instruments are sterilized. The instruments sit here on the opposite side of the sterilizer process, and they have to sit and cool down. If they don't cool down, then they get condensation, and then you'll get a wet pack. At 75 degrees is okay for when you could take these off the rack. And that's very important when you're taking your exam. They're going to ask you about a degree. And it's 75 degrees. Here is the sterile storage. And as you can see, the sterile storage has instruments that have been processed. And you have different services. So this here, this is the neuro. And these are all the neuro instruments. And these instruments right here, the tape is yellow. It's because these are STERRAD. STERRAD is a low temperature machine as far as the steam is concerned. Then you have ortho. You have robotics. And robotics, for your information, robotics is something kind of new. Back in the days, we did not have robotics, but now we do. And most hospitals use Da Vinci. It's general. ENT and plastic usually go hand in hand with each other. Urology and GYN. And the reason why urology and GYN is concerned is because GYN doctors deal with the female, whereas the urologist deals with the male. So you see vasectomy. They deal with the male reproductive system as well as the urinary system. And the urologists deal with the urinary system for both male and female, but sometimes with a female, a GYN can do it too, a gynecologist. And the CVOR, which is the heart, cardiovascular. This is the storage. These are case cards, and the cases come on a computer, as so. And when the case comes down, you're going to get something called a pick sheet. And just remember, for your test purposes, a pick sheet is what the doctor ordered. And on a pick sheet, you have soft goods and hard goods. So I'm going to take you to the soft goods. The soft goods would be something like a pack, cotton swabs, applicators, gloves, whatever's on the actual pack. That's what's needed. So I'm going to show you real quick, like gowns, gloves. These are towels. These are tubes. Different machines. It's also going to need blades for your knife handles. So all of these things is on it, and how we know how to put it on there is because the pick sheet will tell you what kind of surgery it is. And whatever kind of surgery it is, that's what we pick. Now I can't show you an actual pick sheet because of the fact that there's a HIPAA rule because it has the patient's information on it. But I can show you this, that this is how a cart will look. If you see the cart, you have the pack. This is usually a pack that you open up like in the beginning of the case, and then here's your instruments for this case. And this particular case is a vascular case, so that's CVR vascular. And it has all the things that are needed for the vascular. And when you're doing your surgery, or when you see surgery, it's going to be up on this wall here. But you don't see it now because there's no surgeries going on at this time. And that will be your storage area. You just remember, looking at the carts, it's 18 inches from the ceiling to the top of the cart, 2 inches from the floor to the top of the cart, and about 1.5 inch from the wall when the cart sits by the wall. And that is your storage part of SPD.